Hello, everyone. This is Aziza, one of your hosts for today, founder of On Your Narrative 54, global consultant, and class of 2023 MyPad honoree.
And this is your co-host, Jonathan, executive at MyPad, the most influential people of African descent.
And you're listening to the Voices of Influential People podcast, or as we like to call it, the VIP, a show powered by MyPad, connecting you to the most influential people of African descent worldwide. Today's episode is titled Healthcare and Innovation in Brazil. And we are so happy to have our special guest, Arthur Lima, who is the founder of AfroSaúde and also a practicing dentist and specialist in family health. Bem-vindo and welcome to the show, Arthur. Thank you for being with us today.
Thank you, Aziz and Jonathan, for having me. I'm very happy to be here. Very excited.
Wonderful. And as you know, Arthur, well, you didn't know this part, but I'm still trying to work on my Portuguese. But so as you know, we are a global podcast, and I'm joining in from the U.S.
And I'm joining in from London.
I'm from Brazil right now, in Salvador, the city with the most Black community in Brazil. 80% of my city is Black.
Yes. And I wanted to make sure you were good. So in my tudo bem, I'm just asking, are you good? How are you in Brazil?
I'm good. Eu estou bem.
All right. Perfect. And we, like to have a bit of fun here on the podcast too. And we'd love to know and kick off the interview actually to see what is your favorite film and why?
What is my favorite film? Then it's easy. It's Into the Wilds. It's based on a book. So this movie is about a young man that starts his adventure in life after he finished college. So I'm very connected with this story because after I became a dentist, I started to do a completely different thing. And right now in my professional life, I'm starting to coming back to teach in dentistry schools what I learned about entrepreneurship. So Into the Wild is one of the movies that, one of the most important movies for me.
Fantastic. And we'll have to add that to our list too now, Jonathan. That's amazing. And it's beautiful how it connects to your personal story. And speaking of your personal story, we, know that historically marginalized people across the globe, often find themselves rising up with resilience, to challenge the systemic and the structural inequities and inequalities on a daily basis. We face that here in the U.S. as well. And Brazil being a country with the largest population, as you mentioned, of people of African descent outside of the continent of Africa is definitely one of those places that comes to top of mind for me when I think of the continued push, for equity by the people, and the push for equality by the people for the Black population. One of those key areas where equity and equality is still needed is in healthcare and innovation for the Black population. And for you as a medical professional yourself, and founder of AfroSaúde, we would love to understand if you could take us back a little bit and share what set you on this path into medicine and also what further inspired you to start your organization and your company.
Yeah, what inspired me to start a startup, AfroSaúde? First of all, I'm not a medical doctor because here in Brazil, we have a separate school for dentistry. So I am a dentist. So when I was in class, in the master's, I have a master in public health. Someone texted me searching for a Black dentist to do a specific thing for a patient, a colleague of mine, another dentist. And she said that her patient suffered racism inside a dental office. And now that patient only wanted a Black dentist to take care of her. And then I started to look into my networks, my groups, my classroom, and I didn't find a Black specialist in a specific area of dentistry. And then I realized that in my class, from 60 students, only 4 or 5 were Black. So by worry in dentistry, by worry in medicine, by worry in psychology and everything else. So I had the idea to create this platform, this network of Black healthcare providers, not only dentists, but medical doctors, psychologists, nutritionists, everybody, and put them into a digital health platform to provide access to everybody, but especially the Black community. And then I started to understand the whole problem related to health inequities in Brazil. In public sector or in the private sector, there's a history of inequalities in healthcare. Black people here, for example, die more from COVID. They still die more from infectious diseases, from chronic diseases, hypertension, diabetes. There are a lot of cases of racism during a consultation. So that's why we created AfroSaúde. How could we connect, especially Black people, to healthcare providers that understand about race and health issues, and also to work with digital inclusion in healthcare? How can we connect Black people to telemedicine, Black people to AI, Black people to online therapy? There is something so distant for a lot of Black people here. So this is the challenge that AfroSaúde is trying to solve, and is solving step by step during these 4 years that I had this startup.
That is fantastic. You are just amazing, and going ahead in your pursuits, even though there aren't as many examples. Sometimes people say we have to see it to be it. So because you are doing what, you're called to do, you're also inspiring so many other, young people who are seeing you now and saying, I can do this too. So that is phenomenal. And you touched on this a little bit, but I would love to delve into it even a little bit more regarding the similarities, and the differences that you've noticed in your work with AfroSaúde and the Black population there in Brazil to the populations of people of African descent, all over the world, from the U.S., Canada, everywhere. And how has that actually influenced your work? So looking at these similarities and differences, and then looking at how that has influenced your work, we would love to know more.
We face the same problems, but I'd like to talk about, for example, the mental health topic here. That is like this huge ice wall all over the world, especially for the Black communities. So we started to look for articles, studies, and everything else in US, in Canada, because you produce a lot of scientific articles about healthcare, health inequities, and mental health to the Black population especially. And we use that, and we use this data to create a lot of content for our social media here in Brazil, the newsletters that we send to our patients and our professionals. Because unfortunately, this topic about diversity in healthcare in Brazil, we don't talk very much. So I spent 5 years in a dentistry school, and I didn't have, we didn't talk about the health of the Black population, for example. And it is the same thing in medical schools, in psychology schools, nursing schools. And then I did a residency program. I did a master. And only now, where I am in a doctorate program, I'm a PhD student, where I'm researching about sickle cell disease, I had the opportunity to just dive into the health of the Black population. So I spent more than 10 years studying to right now just focus my PhD research about this matter. But after 2020, after George Floyd and everything else, and a lot of things that happened here in Brazil, especially with COVID, we started to talk a little bit more about racial diversity in healthcare, the importance of looking for the health of the Black population, because we are 56% of the population. But I think that Brazil is very far behind in this topic. And we need to produce more information, more data related to this. And that is the information that I always look at the US and Canada to understand more of how all of this works here in Brazil. Of course, we have some researchers, we have some data, but not well documented as the US has, for example, especially data related to the healthcare system. So a simple thing that happens here in Brazil, medical doctors, professionals, they have difficulty on asking to the patients, how do you see yourself? Do you see yourself as black, brown, white, yellow? They don't ask. We don't have this data in a large amount here in our healthcare system. So we are still, in a way, to educate the professionals, especially the non-black professionals, that you need to ask about race, about the race of your patients, because we need to understand who is dying more, who is dying less, who is getting more vaccine, who is not, and different thing that happens in Brazil, the US, is that, for example, we trust more in the vaccines because I understand the US history that the black population has, especially with vaccine and everything else. So here we are more open to. So it's very rare to see like a black in the 80 years old man or woman not wanting to take the vaccine. They are the first one to go. And I know
Yeah.
that in the US it's different because of
So
the whole thing. Yeah, I
yeah.
understand that. So there is this difference.
Uh-huh.
Yeah, I think you touched on a few key points. And one thing I'd like to bring to the limelight is the fact that it's taken so long for Brazil to have that conversation around Black people in healthcare. But I'm glad that it's starting to become more prominent. And of course, as you said, there still needs to be more conversations about the data related to Black people in healthcare. But there's also a lack of access that you've spoken about with Black people and healthcare opportunities. And I'm curious to understand, from your experience, what does it actually mean to be Black in Brazil?
There was an author here in Brazil. She passed away now. Her name is Neuza Santos Souza, and she says that you don't born black, you become black. So here in Brazil, a lot of people discover that they are. A lot of people discover that they are black, like in the 30 years old, 20 years old. So what does it mean to be black in Brazil? We have this fact of the self-affirmation about the race, but all the indicators here in Brazil, the health indicators, they are very bad for the black population. So right now, and again, since after 2020, that we have started to talk more about black people. Um, from the childhood, a lot of parents are now teaching their kids about race. I didn't get this when I was a kid. We didn't talk about race in my family. We started to talk about race in my family after I created AfroSaúde, after everything that happened in Brazil. My mom is a nurse, and now she's a head of an ICU in a hospital here in Bahia. And then she started to realize, for example, a lot of things that happened to her during her professional life were about racism. So now, being a black people here in Brazil is to know that you are always on disadvantage in healthcare, in education, um, public safety, and everything else. But I see that we are in a movement very slow to improve things, but it's very subtle. There's a lot of things to do. And it's strange because I live in a city where 80% of the population is Black, but you don't see this in places here. You don't see Black people in high positions. You don't see Black people teaching universities. You don't see the face of success in my city is not the face of a Black person. So it shows that we have a long way to go.
Exactly. And the issue of representation, as you've mentioned, Black people in Brazil take up 56% of the population, yet when you look around, the representation isn't there, whether it's in politics, whether it's in AI, and this is especially prominent in healthcare. And so what challenges actually exist physically providing mental healthcare services to people of African descent, and what steps need to be taken to improve that access?
So there's a problem that representation of Black people in healthcare spaces. This is one of those things that it's happening in a very subtle way here. Some companies and hospitals are hiring us to connect them with Black healthcare providers to hire them because they are now understanding the need of having more diversity in hospitals, in other different places. But it's very hard because it's taken too much time to the ecosystem to understand that. So, for example, when I graduated, I had some difficulties in finding jobs because there's a difficulty of society to see a Black person as a dentist or medical doctor. So a case happened here last week. A neurologist. She was a Black woman in her 60s. She was about to see a online patient, and the patient jump in and jump off the consultation a lot of times because he didn't know that she was the medical doctor. And then the patient asked her to show the credentials to prove that she was a doctor. This is the level of the situation here in Brazil. And now talking about mental health is responsible for 90% of the consultations on our platform. Mental health, you can understand as consultations with psychologists and psychiatrists, medical doctors. And a lot of our patients that go to our platform, they already had frustrated history with a non-Black therapist. And then they see our platform as a safe place to find a professional psychologist or psychiatrist. And they see as a safe place, and then they start to believe again in therapy. If they can't find a professional in here or her city, that's the goal of the online therapy. He or she can find a professional in a different city, in a different states. This happens a lot. So I think the most important part of our job is to to cut the geographical barriers. When you can't find a provider in your city, you can find another one in other places.
Absolutely. And your company actually helps with that a lot, correct?
Yes, my company helps a lot of that because we work with directly with people. You as a person can go there, try to find a professional medical doctor or anything else. But we also work with companies and organizations, especially those who has a commitment with diversity. So we provide mental health programs with our professionals for those companies to increase psychological safety in workplaces, to avoid professional turnover and everything else. So right now we are working with companies or B2B in a business language, B2B and B2C sides.
That's fantastic. And it's it's awesome to have that type of accessibility, you know, in a space and a place where people can trust, because it takes a lot, you know, to trust because of the history, you know, that people across the diaspora have dealt with regarding the medical industry. So we are so appreciative of that. And we also know that artificial intelligence, or AI, is presenting big opportunities in Brazil, with international organizations like the World Economic Forum, you know, already selecting Brazil as one of the locations for their Center for the Fourth Industrial Revolution. We know that this presents opportunities for both progress and critical areas, you know, along with some unique challenges. But we would love to know your thoughts, Arthur, on the impacts that AI could possibly have when it comes to healthcare in Brazil regarding the Black population.
So my thoughts about AI healthcare in Brazil is that we don't have regulation yet. So we have a lot of solutions going to the market, especially in healthcare. So everybody sees like a gold mine, all good, all new, it's fun, it's innovation. But we are not talking about regulation, we're not talking about bias. So again, I go back to a lot of material that the US has about bias in technology, bias in healthcare. And I read and I say, we are not talking about this in Brazil. Again, in a country where 56% of the population is Black. So I think in a near future, we will have to face this. But since we are close to the elections here, municipal elections, we are now talking more about regulations of AI in politics. But I think this will hit healthcare as soon as possible. But if you don't have regulation, everything else, I think, again, will be having more inequities in healthcare, especially for the Black population, and especially for those who don't know about AI. It's like a bubble talk.
Yes.
A lot of people here in Brazil don't know what's an AI, don't know about ChatGPT. And how can we end inequities, health inequities, if the population, the great mass, don't know anything about artificial intelligence? So there's a lot to talk about this here in Brazil, and I don't see any conversations, or the conversations are very restricted to a bubble.
I agree. I think the conversations regarding representation in AI are very important, especially in healthcare, because once you start to not to include Black people in conversations about Black people's health, or when you stop representing them in the data, it stops being applicable to their actual treatment. And so you're treating them based on data that doesn't apply to them. And so there's no wonder why there's a perpetual cycle of Black people suffering and not being able to find the right treatments and solutions. And so your company, AfroSaúde, that pairing Black people with Black medical professionals, it kind of jumps that barrier. And so that's why, one of the reasons why your work, Arthur, is so important. And time does actually fly, because we're approaching the end of the conversation already. But I do already, exactly. There's so much important information you've told us, and I want to ask you, is there anything that we haven't asked you that you want to share with our audience?
I'd like to talk a little bit more about Black people in science, in researching about Black people in healthcare. This is like when I decided to be a PhD student, to jump to a PhD program, I told my teachers that I have to research about the health of the Black population. I can't negotiate on that. So then I decided to research about sickle cell disease. That is the most common genetic disease in Brazil, and that affects, again, Black people the most. So and right now that I'm coming back to the university as a student, but also as a teacher in a dentistry school, this is a completely different thing. the game because I can stimulate more students to think more about diversity in healthcare, to, um, to think more about research in solutions that are more inclusive, that are more diverse. So I am in a professional place in my life where I'm very happy to be doing that, to be in the innovation entrepreneurship world, to be in the university, to be in the education area. I just wanted to share that, and I'm very happy to be sharing this here in the MyPad network. I started to connect with some people in the healthcare group that to understand where are the universities and the countries outside Brazil that are researching about sickle cell disease. So I'm trying to use the MyPad network to understand more about this world.
Definitely. And that is, a fantastic thing to do because the network, what do they say? It's not about your network. It's about your net worth. It's about the people, that you're bringing in on both sides of the spectrum. And I would also want to just quickly touch on that bubble that you talked about. So as you are speaking about your pursuits right now, in academia as well as healthcare, how are you creating disruptors to burst those little bubbles that we spoke about, and also to combat that aspect of invisibility, when it comes to the population, the Black population in Brazil that makes up, the largest amount, of people there?
So I started to be like a mentor from youth business, especially for all the Black entrepreneurs that are trying to create new solutions. And I always try to stimulate them to be in this world, to create the solutions for their own challenges. But I see that there aren't many Black entrepreneurs in healthcare. Sometimes you go to the places and I'm the only one. So I'm trying like to be close to more young Black folks to stimulate them to do this. Maybe being a teacher in a dentistry school can be the way to do this. But it is a challenge, but I'm trying.
Thank you.
And I'd say to you, keep up the battle, Arthur. It's about progression. We don't solve the battles overnight. And so handing it off in a better place than it was when we received it is the aim. And we do have one more audience question. One audience question before you go, Arthur. Do you have time for that?
Of course.
Wonderful. And so this can be healthcare specific. But the question is there one law that you could create that everybody in the world has to follow? If so, what would it be?
A law that I could create that everybody would follow. Oh man, that one was so hard. It's hard. I don't even know. I think since in Brazil, collecting information about race is a problem, I would put that as a rule. You had to ask about the race of your patients. You need data. There is no problem without data. That would be my rule.
Okay. No, that's a good rule. Focusing from a data perspective, increasing the representation, that's a good rule. I like that one. Thank you so much for the wisdom. And as the audience you've heard, don't forget to submit your questions via our platforms, because you never know, your question might be asked next.
Thank you.
Yes, Arthur, we actually like to say obrigada to you and thank you for blessing us with your conversation. And we want to congratulate you as you are now an official inductee into the VIP MyPad Suite. Woo!
Thank you, Aziza and Jonathan. Obrigado pelo convite. Thank you for the invitation. I'm very happy.
And to our listeners, this has been Aziza and Jonathan. Make sure you subscribe and follow us and tune in to our next episode of the Voices of Influential People, because you just never know who the next VIP might be. Thank you.